Hello everyone, in this video we are going to discuss about the anatomy of the skull, mainly the cranial cavity. It is the space in our skull where the brain and various neurovascular structure lies. The cranial cavity is divided into three fossa, namely anterior cranial fossa, middle cranial fossa and posterior cranial fossa. Anterior cranial fossa is bounded anteriorly by the frontal bone and posteriorly by the sphenoid bone. Middle cranial fossa is bounded anteriorly by the sphenoid bone and posteriorly by the petrous part of the temporal bone. And here is our posterior cranial fossa, which harbors the foramen magnum. So let's dig more details the anatomy of our skull. The frontal cranial fossa has so many foramens, and this is the foramen cecum. This is our crista galli, and this is the frontal crest. This is your anterior ethmoidal foramen, posterior ethmoidal foramen. This is our cribriform plate. Here, from here, our olfactory nerves come out, and posterior to that, this is the laser wings of sphenoid bone, and this is our optic canal, which harbors the ophthalmic artery and the optic nerve. This is our anterior clinoid process. This is our posterior clinoid process. This is the fossa for the pituitary gland, namely hypophyseal fossa. And this is our superior orbital fissure. And from here comes three important foramens. They are R, O, S. R for foramen rotundum, O for foramen ovale, and S for foramen spinosum. And this is our foramen lacerum. And this is our internal acoustic meatus. This is our foramen jugular foramen or foramen juguli. And this is our hypophyseal canal, which harbors the hypophyseal nerve, that is tubus cranial nerve. So let's go in every foramen in details. The first one we named, it was optic canal. Before that there was the cribriform plates, which harbors the olfactory nerve, number one. Second is optic canal. Its content is optic nerve and ophthalmic artery. This is optic canal. And third one is superior orbital fissures, which harbors third, sixth. P2 means maxillary, P1 means ophthalmic, and meningeal branch of lacrimal artery, and superior inferior ophthalmic veins. You can see here it harbors our lacrimal nerve, frontal nerve, trochlear nerve, and this is our optic canal with optic nerve and ophthalmic artery. This is the superior orbital fissures, and there is our oculomotor nerve, nasociliary nerve, and all. And another is our foramen ovale. Its content is MALE, male, means M for mandibular nerve, A for anterior accessory meningeal artery, L for lesser petrosal nerve, and E for emissary vein. You can see here mandibular nerve M, accessory meningeal artery A, lesser petrosal nerve L, E for emissary vein, MALE, male, foramen ovale. Then we have foramen spinosum. Its content is meningeal artery and the nervus spinosum or B3. It is also called mandibular nerve. The main content is, this is our foramen spinosum. It is our foramen spinosum with meningeal branch of mandibular nerve and middle meningeal artery, foramen spinosum. And here comes our foramen lacerum. Foramen lacerum has the inner and outer portions. Inner portions harbor the brain and outer portions is closed after the life. The internal acoustic meatus and the foramen lacerum is same foramen from inside. So the main content of foramen lacerum is internal carotid artery and sympathetic plexus and greater petrosal nerve. You can see here greater petrosal nerve, sympathetic plexus with the internal carotid artery. Next, our internal carotid artery, which harbors the 6th, 7th, and labyrinthine artery. You can see here internal acoustic canal. And next is our foramen juguli or jugular foramen, which contains 9, 10, 11, and some sigmoid sinuses. You can see here inferior petrosal sinus, IPS, sigmoid sinus, and 9, 10, 11. 9 is glossopharyngeal, 10 is vagus, and 11 is accessory nerve. Next is hypophyseal canal, which contains the 12th cranial nerve. This is the hypophyseal canal. It contains the cranial nerve 12, hypoglossal nerve, which is supplied to the tongue. So, in summary, we can see this chart. We have the anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. The anterior cranial fossa has the frontal crest, foramen cecum, crista galli, and cribriform plates from where the olfactory nerves come out. And there is a anterior ethmoidal foramen and posterior ethmoidal foramen. And here is our laser wing of sphenoid bone. There is a superior orbital fissure, and this is the hypophyseal fossa for pituitary gland. This is our optic canal. This is our superior orbital fissures. This is foramen rotundum. This is foramen ovale. And this is foramen spinosum. ROS is the mnemonic for that. So posteriorly, this is our internal acoustic meatus. This is our jugular foramen, and this is the hypoglossal foramen, and the bigger one is foramen magnum. So that's all about the cranial cavity and its some content. Thank you.